My name is Ryan Osborne. I trained as a head and neck surgeon in South Central Los Angeles, managing the most complex cancer and trauma patients in the country. I've operated across the globe in first and third world countries. My experiences have taught me the value of flexible and innovative thinking, but I realized that our healthcare system doesn't always allow for that. So I started Osborne Head and Neck Institute. I made it my mission to find the best, most creative surgeons around, and I gave them the space to excel. Together, we create a new standard in medicine. These are our stories. What made us decide to go is we have a mission here at the Institute, and that is to show excellence both locally, regionally, as well as internationally. And we felt that we had achieved our local and regional goals, and it was time for us to embark upon spreading our influence internationally. And we felt the best way to do it would be in a form of a medical mission.
From the time that we got on the plane, actually, to the time that we arrived there, the thing that was on my mind the most was that I had to bring everything I could possibly bring to make this a positive experience for my team members and especially for the patients. In my mind, there wasn't room for error.
Once we arrived in Ethiopia, it was overwhelming.
I just remember it was like being in a movie. The whole crowd just rushed the school bus.
I think roughly 900 to 1,000 people at the hospital already lined up to be seen.
We would start the day around 5 a.m.
We would have probably over 100 patients already waiting by the time we would get there. And we would see them in a clinic and really assess what were their needs, what was the problem that had brought them there. There was a team that was down in the clinic doing that every single day.
At the same time, we would simultaneously be prepping the operating room for cases that we were going to do for that day.
And we would have anywhere from 1 to 2 operating rooms going at any given time.
Our specialty really requires that we have certain tools and certain supplies in order to do what we do. And so going to another country and not really being sure what was actually available or what was in working condition, it mandated that we be prepared to bring everything. And that's a challenging and a daunting task.
The facility, the hospital, was a lot different than ours. Things such that we take for granted, like suction and power, are not consistent there.
We experienced blackouts, equipment malfunctioning, equipment that didn't work, so those were definitely some of the tougher issues that we came across.
You're just not familiar with how things run. You don't have all the tools that you're used to having. There's different standards for cleanliness and for what's considered disposable and what's not. What are the cultural expectations? How do you communicate with people? I mean, there was a lot of challenges, but I think that we had such an engaged team on the Ethiopia side as well as on our side that it really did run smoothly despite all of that.
As far as any patients that stood out, one of them that stood out was a 6-year-old boy born with microtia. He wanted to have a normal looking ear. He wanted to be able to go to school and not be teased and so on. It was a long case. It took about 6 hours to do this case, and because the anesthesia there is different than the anesthesia here, and the medications used are different, it took him a long time to wake up from anesthesia. We had him stay overnight in the intensive care unit while he woke up, and the next day we went and saw him, he was awake. It was one of those cases where he was very grateful. I'm still in contact with parents. I'm very touched by the amount of love and by the amount of gratefulness that I'm getting from the family and from him. And he's still healing, but he's very happy and grateful, and I'm very happy with the results.
I remember there was this one child that just kind of made me just kind of pause.
He had a big parotid tumor, and he came at the end of the day. I'm gonna have a hard time telling you about it. And we weren't taking patients at that point anymore. But I was like, Dr. Osborne, you have to see him, you know, he's young and you have to see him.
Just looking at this child's face and looking at the deformity that the tumor was causing, it just made me feel like, I mean, we've got to try to do something for this child.
He had cancer, and I'm sorry.
There were a lot of things that kind of had a big impact on how we approach patients that we would never even consider here.
We couldn't treat him. Like, I wish I could tell you a good story that we treated him, but we couldn't, and it wasn't that we weren't ready. Like, we were ready, but his parents weren't with him. Like, he was under the care of an uncle, and we needed permission from the parents to proceed with surgery. It was a big surgery, and so unfortunately, we didn't do that surgery, and that was it. Yeah.
From a medical standpoint, she's probably a 13-year-old girl who had some really horrible ear infections, and it had happened to her when she was so young that she's basically been deaf because of the infections in her ears since she was probably age 3. And because of that, she never developed language, so she's unable to talk, and she couldn't hear, and she was unable to really communicate because she hadn't gotten an education in sign language as well. So you're looking at this beautiful young lady, and she's unable to communicate with the world over a simple ear infection that we would have treated with an antibiotic, you know, from the pediatrician for a couple days.
And just to think of that for a child, if it was your child, that they have a medical problem, but there's no experts there to take care of that medical problem, was just amazing to just try to fix that solution while we were there.
There was one particular case. It really wasn't anything super complicated. It was just tonsillectomy on a little girl.
Before this surgery, I had actually sat with her and I was playing with her and getting to know her, and just to calm her down before her surgery. And
this girl had a complication waking up from anesthesia.
She was coding.
Her oxygen level was dropping below normal. And at that point in time, our team just converged on this little girl. I mean, all of us just kind of ran to her side. And that's where you really saw the team come together.
Our anesthesiologist and our team brought her back.
A lot of people thought this child was not going to make it. We did not give up, and we fought and we battled and we hung in there, and we brought that girl back.
She was okay and she did great.
We're not giving up. We're going to keep going. This is like our child. And she came back, and I have this photo in my head because someone took a picture when I was carrying this girl. I didn't even want to put her on the gurney to roll her back. I wanted to carry her and literally like put her back in her parents' arms. And we were able to do that.
That was someone that definitely stuck out to me. She touched my heart. She's a very sweet little girl.
We have everything here. We have all kinds of healthcare clinics over here in the United States. But when you're out there, it's like you want to help everybody. And it's very challenging because you're only one person. And yeah, we went as a group, but you want to help everybody as much as you can. And you really can't because you're limited.
I think the most memorable thing on this trip for me was the cohesiveness of us as a group, how we worked together to see so many patients and accomplish so many surgeries.
I think it was a chance for us to all come together and kind of work with each other outside of the standard medical environment. and we had a chance to kind of bond and work with each other as a group outside the country and helping patients that were in a lot of need.
To see how all these people that we work with on a day-to-day basis here come out of their roles, out of their comfort zones, really fill in the gaps where they were needed, unite as a team, and really surgically take care of over 50 patients in such a short time, burning the candle from both ends but never complaining. It was really a reinforcement of why these people matter to us even here. It was the team.
We truly do help each other when needed. We all take on multiple roles. It's not just each person has an assigned task. We do all that we can to help everybody with what they need to get done to provide the best care for patients and the best outcomes.
We're just getting ready to operate on him. He has a subtotal perforation in his right eardrum, and we're going to take him into the OR to have this repaired.
What touched me the most was when Dr. Nazarian was able to bring back that little boy's hearing. He changed his life.
His mom and he, they were both like so grateful after. They welcomed us after with cake and all of that, and she was just in tears after, and she was just so grateful that we helped her son. So that just, it meant a lot.
Thank you for the team, and my special thank you goes to Nazarian.
Just the gratification that you get from a smile, from a thank you, from these patients that were pretty much hopeless. I think that sticks out the most for me.
It was just a friendly interaction between the doctor and a family or a patient, and we're just here to help and give you everything we have. And it was just really the sensation of why you wanted to be a doctor in the first place. I think that's one of the times that I felt it the most in my whole career so far.
The most rewarding thing for me was to get in touch with what made me want to be a physician. You were going to be perfectly fine. The tumor was completely removed. All your nerves are totally intact. And we're happy with the results.
I'm so happy too.
I never went into it for money. I didn't go into it for prestige or fame or recognition. I didn't even go into it so I could say I was a doctor or wear this white coat. I went into it because I wanted to help people, and I actually was able to do that.
Just getting that opportunity to do something good was amazing.
The trip is life-changing in the sense of just perspective. It shows you that we really are very blessed and privileged to be in this country and to have all the things that we have that we take for granted every day. When people talk about like not having things here, complaining, and then you go somewhere like Ethiopia and you see like actually what not having much is, really it just, like I say, it throws things in perspective. So it really helps you to kind of focus on the important things in life and not the small things or the inconveniences.
The most memorable thing for me on the trip was the day that we went to the orphanage. I think that was actually probably the best day of my life by far.
One of the things that the kids really enjoy is playing soccer, but they don't really have goals. They kind of just put anything together and they can make that a goal. So what we did was we brought goals with us over there and we built them for them. And we decided to have a little match. So it was Team OHNI against the kids, and let's just say that they walked away with a victory, but it was a close game, and we should have won, but.
It's extremely rewarding to be able to do something like this. It's really why we go into medicine. This is it. This is the essence of it. It's not to fill out paperwork or look at insurance company cards and CPT codes. It's to help people who need help. And at the bare basic principle here, this was a group of people that needed a service that we could provide, and they were grateful to have it, and we were more than happy to provide it.
This team did a great job.
We are happy having you here.
I am very grateful for the team, and for the person who are behind this mission, directly or indirectly, more people are just participated in this mission, and I'm very grateful. God bless you all.
It just doesn't really get any better than that.